The purpose of this video is to describe for patients who've been prescribed a GEMPro test how to get good data from the comfort of their own home. Your dentist should have provided you with a kit that looks something like this. Included in the kit is a tablet, the instruction card as you see there, and a variety of cables and 2 sensors. When the kit is unpacked, you'll have a wrist oximeter and a finger probe, an amplifier with an EMG foam pad adhesive. Both those sensors are wireless and transmit their data to the tablet. The tablet has 2 ways to turn it on. There's the main tablet power button, which is kind of right here. And then there's a second one on the kind of edge right there. It's hard to see in this image, but that also can be used to turn on the power. On the top of this slide, you'll see there's a PDF report via Wi-Fi. That is a capability, but only if your prescriber or dentist has asked you to connect to Wi-Fi. If they have not, then don't worry about that. It's an option. And finally, on this slide, I wanted to point out we're going to be having you plug the tablet in, and the tablet power receptacle is right there, kind of where it says Samsung, but on the side. And here's an image of how that power cord gets plugged into the tablet. If your dentist has asked you to connect to Wi-Fi, it works exactly the same way you connect your phone to Wi-Fi, and that is from the top edge you scroll down and you click the settings gear icon and select Wi-Fi. And when you select Wi-Fi, you'll see all your available router nodes, and you select yours and type in your password, and that's it. That's all there is to it. If your prescriber didn't give you these instructions, then basically ignore what we just talked about. Okay, on your tablet, your dentist should have provided you with a 4-digit PIN. Once the tablet's turned on, from the main screen of the tablet, you click the Bluetooth icon. It's called PhysioPlex, and it will open up the app that you see on the screen. And you're only going to be worried about patient login, kind of there towards the bottom middle of the screen. And you'll be typing in the 4-digit PIN provided by your dentist, and it's going to be either a T PIN or an R PIN. Once you type in your PIN, this is the screen that shows up next, and guess what? You click Next. By the way, your name should appear here. If it's not your name, then you might want to give your dentist a call. At this point, we're going to have you turn on the amplifier that we showed you earlier, and the amplifier has a small black slide power button on the side of it, and you just slide it up, and you'll notice once it's turned on, the amplifier LED green light will start blinking green. And on the wrist oximeter, it's pretty simple. There's a blue button on there, and you just tap the blue button and the oximeter turns on. And we're going to do this in a second because the tablet's going to want you to have those 2 devices powered up. Okay, on this screen, when you click Next, this is the screen that you're going to go to. So between now and here, you will have turned on the amplifier and the wrist oximeter, and you'll have plugged in the tablet like I showed you just a second ago, using the white cable and plug it into the kind of the top of the tablet. And when everything's turned on, the 2 sensors and the tablet's plugged in, the screen will look like this. And then once the screen has your 3 green check boxes, you just swipe from right to left. And when you swipe from right to left on this screen, the first question we're going to ask you is, are you wearing therapy, an oral appliance, or something of that nature? If you are, you click yes. If you're not, you click no. Then you swipe again. And on this screen, we're going to show you how to attach the amplifier to your pajamas or shirt. There's 2 basic steps here. One is we're going to clip your amplifier to your shirt or pajamas, and there's 2 clips. There's the little silver clip with a black cord, and then behind the amplifier is an alligator clip, and I'll show you how to operate that. And then there's a cable with a white foam pad. The white foam pad it has an adhesive surface protected by a clear plastic sheath. In this picture here, I have the clear plastic sheath kind of brown, so you can see it. but you just separate the foam part from the clear sheath, and then you have a very adhesive pad, and you put that on your cheek muscle. To find your cheek muscle, you just bite down, and where your muscle on your cheek, you feel on your cheek, and where you feel your muscle bulge, this pad goes there in the vertical orientation. And by the way, that pad is very sticky, so hopefully you get it that first time. Okay, this is just wanted to show you a picture of how that clip works. Because when you look at it, sometimes it's not exactly sure which side you're supposed to operate. So we put a little lift sticker on there, you lift it up, and that's how that clip works, okay? All right, once the amp's attached and you swipe, this screen here is going to make sure that your amp is in a vertical orientation. The reason for that is we have a built-in body position sensor in the amp, and it needs to kind of know its orientation in order for that body position data to be accurate. When you swipe again, this screen is just going to show you how to put on that wrist oximeter. It's a fairly simple thing to do. It's probably already powered up from the startup sequence that we went through a second ago. So then you just put the wrist oximeter on your non-dominant hand and then put your finger probe on. And that's all there is to it. After a few seconds, you'll see your SpO2 and heart rate in a little kind of wavy waveform on the screen of the oximeter. If your dentist has provided you with a roll of tape, it's a good idea to put a little strip of tape right about here, and that helps secure the finger probe. All right, swipe again, and we're going to be here. This is kind of an important screen, excuse me, and what we're going to do here is we're going to measure how hard you can bite down. So there's a screen here, and when you click play, the play button, the forehead on this guy is going to start out saying relax, and then it's going to say clench for 3 seconds, and then relax for 7 seconds, and you're going to do that back and forth 4 times. Now on your tablet, there's only one guy there, and it says relax or clench on his forehead. But at the end of the 4th clench, the screen this time is just going to automatically propel you to the next screen. And here is an audio recording, and what we're doing is we're going to listen to your bedroom for a few seconds and use kind of noise canceling technology to subtract the room noise from our audio signal, and that will leave, if you snore, it will be a more accurate assessment of your snoring. And again, once this is done, listening to your room for 10 seconds, it will automatically take you to the next screen. And here you only have to do 2 things. It's a little bit of a busy screen, but you only have to worry about turning off the green LED light by tapping this blue button right here. The LED green light is blinking fairly near your face, and most people wouldn't want that blinking in your face all night. So this turns off the LED light but leaves the amplifier on. The other thing that you do on the screen is click next. Now when you click next, it starts a 10-minute timer, and we're ready to go. So go ahead and get comfortable, get into bed, and in 10 minutes the study will start recording. If you for some reason want to start the test now, you can by clicking start test now, but we do like people to relax a little bit before we start recording. So after 10 minutes, or if you've clicked start now, the acquisition starts, and this is what the acquisition screen looks like. There's a couple of elements here. We have your SpO2 and heart rate here. Hopefully you're sleeping and you won't have to be looking at this. The EMG is here. And then in the middle, there's an elapsed timer, and there's an orange line that will eventually make its way to this hash mark, and then that's how much time we've recommended that you do the study. And once you would sleep long enough and get to that point in time, this line turns green, which means you've slept long enough. If you're still asleep, you don't care because you don't know that you've done that yet. But when you wake up and you see a green circle like that, that means you slept long enough. If by chance you wake up, the line is still orange, and let's say it's, 5 minutes and 45, or 5 hours and 45 minutes, and you need to get up to go to work or something, it's okay. Just click end test. It's still a good test. That time is a goal, and we like people to sleep 6 to 7 hours a night. Okay? So once you're done with the test, the first thing you do is click end test, then take off the oximeter and amplifier. If you take off the oximeter and amplifier first, that kind of has a bunch of artifact in the study at the very end. So it's better just to end the test first, then take everything off. Okay, so you click End Test, and there's a gyration that the tablet goes through, and when it's done, it will actually show you some of your data. But what you need to do on this screen is click the Next button. You'll see it says Next. It's actually blinking, so it's pretty easy to find. And then you click Finish, and OK, and that's all there is to it. Now, at this point, once you've completed the test, if you by chance have connected to Wi-Fi, we're going to email a PDF preliminary report to your dentist. If you have not connected to Wi-Fi, the tablet will save the report until you return the system back to the dentist office, and then at that point in time, your PDF report will get uploaded for your dentist to review. Okay, in some cases, your dentist is going to ask you to do more than one night. So there's a couple things you need to keep in mind. There's two basic things. One is hopefully your dentist gave you more than one foam pad. So the foam pad that you took off, that adhesive probably isn't that strong anymore. So you should remove the used foam pad and put on the replacement, snap on the replacement one that presumably they gave you. The other thing you have to do is recharge the oximeter and the amplifier. The oximeter uses the black wall plug and the black cable, and the amplifier uses the same power that you used for the tablet, which is a white cable and a white wall plug. And they only need to be recharged for an hour or so. But if you leave them plugged in all day in the morning and then unplug them when you get back from work, for example, that's okay. It won't harm anything. And then you'll have two fully charged sensors for your second or third study, what have you. Okay, so that's all there is to it, and good luck, and hopefully you'll get a good study.